Attention, everyone! Sudden accidents can lead to a significant number of injuries and illnesses. The process of rescuing, treating, evacuating, and transferring these individuals is extensive and influenced by many factors. To improve rapid disaster response and implement effective rescue operations, it is necessary for the government and management departments at all levels to provide unified command, take responsibility at different levels, and coordinate the organization and management of the rescue operations. How should this be implemented? In this lesson, we will learn about the organization and management of rescue operations in accidents. First, understanding the organization of medical rescues for disasters and accidents. This includes standing organizations, the establishment of emergency medical rescue command centers at the site of the sudden accident, and the organization of emergency medical rescue forces. 1. Standing organizations. 1. The Ministry of Emergency Management of China organizes the formulation of national emergency plans and strategies, guides regions and departments to respond to sudden accidents, and promotes the construction of the emergency plan system and plan drills. 2. Local governments should establish emergency rescue command centers to provide various emergency rescue services during normal times. In the event of a disaster, these centers will serve as the highest command authority of the local government to carry out rescue operations during disasters or accidents. 3. Health administrative institutions at the provincial, regional, municipal, and county levels should establish medical rescue leadership teams for disasters and accidents and operate under the leadership of higher-level authorities. 4. Comprehensive hospitals at the county level and above should establish standing emergency rescue teams for sudden accidents. 5. Local Red Cross societies and humanitarian volunteer organizations can establish standing emergency rescue teams for sudden accidents, working under the guidance of local emergency centers, stations, to participate in on-site rescue efforts. 2. Establishing the Emergency Medical Rescue Command Center at the site of a sudden accident. 1. Local medical emergency centers, stations, should establish a medical rescue command center. In the event of a major sudden accident, it will automatically transition to become the local government's Emergency Medical Rescue Command Center, exercising organizational and command authority for medical rescue at the accident site. 2. Under conditions where the local emergency center, station, and emergency network are well established, if the chief of the local health administrative department has not yet arrived at the accident site or has not yet intervened in the rescue, the department should delegate emergency command authority to the emergency center, station, for responding to sudden accidents. This includes commanding local health resources such as personnel, vehicles, medicines, and supplies to assist in the rescue. 3. Organizing emergency medical rescue forces. 1. The forces that can be mobilized include emergency rescue teams for sudden accidents, medical first aid teams, military and armed police forces, civilian organizations, and relevant international rescue organizations. 2. Confirmation of on-site medical rescue command authority. The chief of the Medical and Health Administrative Department who arrives at the site first will exercise the command authority. The temporary on-site command team will then take over the command authority as soon as it arrives. Medical rescue teams from other units must obey the instructions of the temporary on-site command team. The leader of the emergency rescue organization who arrives on site will set up the Emergency Medical Rescue Command Center at the accident site. The temporary on-site command team will transfer the command authority to the leader and report on the rescue situation. The local government leader who arrives at the scene will establish the on-site Emergency Rescue Command Center, and the Emergency Medical Rescue Command Center must report to and accept leadership from this new command center. 3. Organization procedures for rescue operations in accidents. Issuing commands, rescue orders are directly issued by higher authorities or the command center. The professional medical rescue team should immediately be organized to carry out rescue operations, and reinforcements should be organized in a timely manner based on the progress of the rescue. Dispatching emergency teams. Within 1 minute of receiving a distress call, an emergency team should be dispatched to preliminarily understand and verify the situation at the site, facilitating the dispatch of personnel, rescue workers, and vehicles to the scene. Dispatching rescue units. After sending out the emergency team, the rescue units should be organized and dispatched immediately. For mild disasters, no more than 5 vehicles should be dispatched. For moderate disasters, no more than 10 vehicles should be dispatched. For major disasters, at least 10 vehicles should be dispatched. The number of vehicles may vary depending on the specific situation. The organization of subsequent rescue units will be determined by the on-site command team. After understanding the organization of medical rescue for accidents, let's continue learning how to make medical rescue decisions based on the type and extent of the disaster and injuries. 1. Activate the Emergency Medical Rescue Command Center. In the event of major or extremely major natural disasters such as earthquakes, floods, fires, mudslides, and snowstorms, as well as major or extremely major sudden incidents like traffic collisions, explosions, mining accidents, hazardous chemical spills, and terrorist actions that cause a significant number of casualties, the local government must activate the Emergency Medical Rescue Command Center. 2. Make medical rescue decisions. Medical rescue decisions should be based on the type and characteristics of the sudden accident, the number of casualties, the on-site environment and conditions, and the rescue plans in place. 1. For fewer than 20 casualties, mobilize personnel and vehicles from the emergency network for on-site rescue and reasonably divert the injured and sick. Local police, traffic, and fire departments should assist with medical rescue efforts. 2. For 20 to 50 casualties, mobilize personnel and vehicles from the emergency network for on-site rescue and reasonably divert the injured and sick. Local police, traffic, and fire departments should assist with medical rescue efforts, and large hospitals should be organized to receive the injured and sick. 3. For more than 50 casualties, mobilize personnel and vehicles from the emergency network for on-site rescue and reasonably divert the injured and sick. The local government's emergency rescue teams for sudden accidents, as well as medical institutions' emergency teams, should be called to assist in on-site rescue efforts. Local police, traffic, and fire departments should assist with medical rescue efforts. Military, armed police, and other rescue forces should be mobilized for on-site rescue, and multiple large hospitals should be organized to receive the injured and sick. 4. In the case of larger-scale natural disasters and extremely major accidents, if the disaster affects a large population and exceeds the local medical rescue capacity, the local government should request higher-level authorities to mobilize national emergency rescue teams, military forces, armed police, and medical rescue forces from neighboring regions to participate in on-site rescue efforts. 3. Provide disaster information and predictions. Comprehensive disaster information, including the type, time, location, scope, and number of people involved in the sudden event, and disaster prediction should be provided to help guide the leadership in medical rescue decisions. 4. Establish a decision support system. A decision support system should be established to address the following issues. After disaster data is collected, it should be input into an intelligent decision-making system via human-computer interaction for analysis and prediction. Analyze the capabilities of the medical rescue teams. Assess the level of material support and develop a rescue plan based on these evaluations. 5. Task understanding and task breakdown. Comprehend the medical rescue tasks and help the leadership in making the right decisions and deployments. Break down the tasks into key categories. Basic tasks like search and detection, rescue and extrication, basic rescue, advanced rescue, reasonable diversion, and safe transfer. Now let's proceed with the implementation of on-site medical rescue during disasters and accidents. 1. On-site medical rescue. 1. After receiving the medical rescue order, the units involved in the rescue should immediately form teams and head to the scene. Upon arrival, they should report to the Emergency Medical Rescue Command Center and accept unified command and deployment. 2. During on-site medical rescue, victims should be categorized according to their injuries or illnesses into 4 priority groups: first priority, second priority, third priority, and fourth priority. This is marked using color-coded labels red, yellow, green, and black on the victim's left chest or other prominent areas for easy identification by rescue personnel to take appropriate emergency measures. 3. During on-site medical rescue, the principle of the saving lives first and treating injuries second, and prioritizing severe injuries over minor ones should be followed. The details of each injured or sick person, including their condition, emergency treatment, and other important notes, should be recorded on a patient status form and placed inside the victim's clothing pocket or carried securely on their person. 4. Based on the condition of the injured and sick at the scene, establish operating rooms or emergency treatment rooms, departments, as needed. 2. Transfer of the injured and sick. After the on-site triage and emergency treatment, the injured and sick should be transferred to the nearest hospital according to the severity of their conditions. The Medical Rescue Command Center will decide the diversion method, receiving hospitals, and travel routes based on factors such as the number of casualties, types and severity of injuries, transport distances, the specialties of hospitals, and their emergency capacity. The center will also be responsible for contacting the receiving hospitals. If necessary, a casualty transfer command center should be established to coordinate the transportation and logistics of the injured and sick. Lastly, the efficient organization and execution of rescue operations in accidents are closely related to the collaboration and coordination among medical rescue departments. This includes cooperation between different levels of emergency rescue institutions or organizations, such as emergency centers, hospitals, and Red Cross societies, coordination among medical rescue, public health, and epidemic prevention departments, collaboration between local authorities and the military, and cooperation between domestic and international organizations. That concludes our discussion on organization and management of rescue operations in accidents. We covered the organization of medical rescues for disasters and accidents, making medical rescue decisions based on the type and extent of the disaster and injuries, the implementation of on-site medical rescue during disasters and accidents, and collaboration and coordination among medical rescue departments. This lesson ends here. See you in our next lecture.